Medicare is apparently refusing to pay for breast cancer scans. And here to talk with us about that is Jae Oh, author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
So there are various published reports about Medicare perhaps not paying for breast cancer scans.
Right. And these headlines, kind of prove a point, and it's an example of a point, which is that Medicare has the right to define what is covered by Part A and Part B and is not. And we've discussed a lot about the pressures on the Medicare system, largely due to fiscal and demographic reality. So I'm not going to say whether or not they should or whether this is fair. It's mainly the point that the cost sharing burden can change over time. And things like this are a very good example of it, where something may have been covered by Medicare in the past at no cost, and it changes. And that will ripple down. The ripple effect will easily be understood, which is that all of a sudden your Medicare Advantage plan may actually charge you for a diagnostic screen if depending on the Medicare Advantage plan you have. For Medigap, while it may not seem that it's different, meaning that you may have already met your Part B deductible and therefore it costs zero, that down the line, what can happen is that, well, the Medigap carrier has covered you in the past, and now they will continue to do so. There's no question about that. But it is just that the cost of claims that the Medigap carrier will face will increase. And that then is going to be used to projecting future Medigap rate increases. So while it is disturbing to the everyday person who, for example, doesn't have either Medicare Advantage or Medigap, that all of a sudden they get a bill. These types of things can happen and will notably and very predictably change through time.
Now, according to the published reports that I read, if a woman was to get a mammogram and then be recommended for an additional screening because the mammogram doesn't maybe detect everything, that's where the extra cost could be incurred. Is that correct?
Yeah, and that's correct. And you can see this in other instances. For example, a colonoscopy is a very obvious one, where the original screening can be zero, meaning that it at no cost to the Medicare beneficiary, just because it is covered under the umbrella of preventative care. That said, if they find something that requires further examination, that the follow-up to it can be subject to out-of-pocket costs, yes, that is predictable, and pretty much for those people who are new to Medicare, can become newsworthy to them.
And let me go back to women for a second. If they've had a mammogram and then are being referred for additional scanning, they would be told in advance that there would be a cost associated with that.
That is a very good question, Bob. I can't tell what, anecdotally yet, meaning that in theory, the answer should be yes to that. In addition to that, if Medicare does not cover any service in advance, that a doctor should be providing in writing that notification to say this is a possible Medicare denial of service, meaning that, for example, a secondary screen or a particular referral, for example, may not be approved by federal Medicare, in which case they would receive a notice. It's important to note also the nuance here is that under Medicare Advantage may or may handle it differently. That is their right to do so, in which case a different path for communication. Complicated stuff when you get into this second layer of healthcare services.
So one last question from a policy perspective. Medicare seemingly is focused on preventative measures, and to not do this, to make patients pay for this scan seems counterintuitive to this notion of preventative medicine.
Right. I think that that's what we started with, which is it just kind of highlights how complicated, difficult the balance actually is. All stakeholders are under tremendous pressure, meaning that with this year 11,000 people a day becoming Medicare eligible, that we are going to have these ongoing headlines. And I don't think there's any easy fix, any easy solution towards that as they grapple with a huge number of Medicare beneficiaries and pressures on all of the different stakeholders from doctors to hospitals, pharmaceuticals, as well as insurance carriers.
Yeah. So, any words of wisdom, actionable advice for women who may be listening to this who are our Medicare beneficiaries?
Well, what I would definitely do is make sure, for example, if you're a Medicare beneficiary and, for example, in Medicare Advantage plan member, that they'll want to check with their carrier. In addition to that, for people who are under Medigap and have already met Part B deductible for the year, this should not be a cause for concern as long as original Medicare approves the secondary screen, secondary healthcare service in that instance.
Jae, as always, but particularly today, thanks for sharing your knowledge and wisdom with us. It really um, it made the waters less muddy, I think.
I don't think that I'm going to be able to clear them entirely, Bob, because of the external moving factors, but it's certainly a privilege to be here with you.